At that. My name is Priscilla Regina Naloga. Now we're going to be taking note into the health sector and a lens here and there to see how best we can move forward. And there's different entities that have decided to join forces with the ministry in order to ensure that they breach the health gaps that have been existing or have seen to be causing challenges. Now today the healthcare organizations are facing unprecedented challenges to improve quality and access to healthcare service packages, and as such, innovations in health have become a major focus once again, with the goal to reduce the healthcare disparities. In order to address the above need, I am joined by Ruth Obaikol, Implementation and Scale Lead at the Academy, which is at the Infectious Diseases Institute at Makerere University, for health innovations that they have come up with and a conference in that regard. You are most welcome, Ruth.
Thank you, Priscilla.
Good morning.
Thank you for having us here. Good morning.
It's a pleasure.
Good morning, our viewers.
So let's talk about the Health Innovation Conference that is coming up. It's a two-day conference, but we want to first understand, where did it start from and why have you continuously had it in regards to what is happening in the health sector?
Thank you, Priscilla. So the Health Innovations Conference is a platform that was created 4 years ago. This year's conference will be the fourth in existence, and it was really created to provide a platform for health innovators. We know that there are very many people there doing their thing, innovating, and finding it difficult to network and connect with policymakers, connect with researchers, connect with private sector. So it's basically a platform that gives an opportunity for an investor to come and showcase their investments, but also interact with topical issues within the health sector. What are the gaps? So it provides a platform for us to be able to discuss topical issues while providing a platform for innovators to showcase and giving them the opportunity probably to meet investors and people who might absorb and adopt their innovations. Oh. So the first conference was in 2002, for example. It was about ideas that can be generated within the health sector, innovation ideas. The second one was about sustainable health. The third one was about sustainable health, and the fourth industrial revolution, and now this is the fourth conference that we are holding this year. Okay,
all right. So three that have gone past, they have been identifying the gaps and trying to mitigate and find a way of bridging those gaps. Could you tell us what have been the impact directly on the health sector with the past three conferences that you have held?
So our first conference was really the maiden conference, and really it was one that raised the appetite for this kind of platform where different players come on board. But definitely through the years we have seen some innovators gain confidence in their innovations. Some of them have got networks that help them leverage their innovations so that they can be adopted. They've also got a platform to communicate. So some of these innovations have actually got more visibility. And they're able to communicate their innovations. The first innovation was more internal and had very few players, but now we are seeing more people beyond the borders of Uganda. So we are targeting more, having an Africa-wide outlook.
Oh, that's good.
Yeah. So
we have to realize it's a global community now.
So last year, actually, we had a digital, a virtual conference, and we had people beyond Africa attending. And we have now presenters from South Africa, West Africa, and broadly East Africa, Central Africa from DRC. So it's gaining momentum, and I believe that with time, innovators are going to really benefit from being visible. And yeah, we hope that more innovations will be absorbed within the health sector to improve quality and access to healthcare.
Okay, so I believe that all those attractions come with dependent on what the theme for the conference is. So looking at this time's theme, building resilient healthcare systems through innovation, how are you going to ensure that Uganda achieves this kind of status in theme?
Yes, so first of all, when we talk about resilience, we are talking about a healthcare system, for example, going through a major shock. Yeah. For example, we've gone through the COVID-19 pandemic, and we all know how
we're still going through it. China
yes, we are. Yes, with it. Yeah. And of course, for us in Uganda, after the COVID pandemic, then we had the Ebola situation. So there's definitely been a shock in the healthcare system, strain in capacities, infrastructure, financing. We know that when Ebola came, you saw the conversations around financing. How do we finance now this current epidemic? That shows you that there was really a shock in terms of the pillars that support delivery of healthcare. And so when you talk about a resilient healthcare system, you're talking about how a healthcare system is able to plan for such emergencies, but also you're talking about how it can minimize the negative effects that can come out of such a situation. Yeah. And then also how we can take the learnings of these epidemics and make sure that, for future purposes, we are smarter and able to respond. So this is the issue for this current Health Innovations Conference, and we have lined up. We have a beautiful program that discusses many dimensions of the healthcare system. For example, we talk about universal healthcare coverage. We talk about equity. Within an epidemic or a disaster, there are certain minorities and vulnerable groups like the elderly, the children, women, and others that can be excluded. So how can we be comprehensive, encompassing? How can we include everybody? How can innovations help us to keep an eye on everybody so that we leave nobody behind? So that is the spirit in which this conference is being held. So there will be also issues of emerging technologies. What are the new technologies that are coming on board? And so actually this Health Innovations Conference is not about only innovators, but also consumers. The average Ugandan should be able to log in and participate and know, in terms of technology, how are we positioned? And for example, if you see vaccines, when vaccines come on board, we fear so much, and it's because we know very little. So by interacting with such platforms, information is key. Yes, we should be able to consume this information and make better decisions moving forward. Okay, all right, Ruth. Could you share with us the actual details of the conference? So the conference, you've talked about the theme of the conference. It's about building resilient and sustainable healthcare solutions that through innovations. And the conference will be held on the 12th and 13th of December. It will be a two-day conference running between 8 and 5 p.m. Here at Serena. It's going to be a physical conference this year, and we are going to have different speakers, high-level delegates from the donor, the major donor agencies. We'll be having the WHO, we'll be having CDC, we'll be having UNCDF, but also we'll be having the local actors, the health sector actors, like the Ministry of Health, but also information, the Ministry of Science and Technology, but also Ministry of Information and Communications and Technology. And then, us, the innovators, normal Ugandans, consumers, private sector, researchers, universities, and, the general population. To join the conference, you are required to pay a humble fee of 100,000. Even your voice has humbled itself. Yes, it's a humble fee, and I think given what you will interface with, it is so totally worth it. So that's 100,000 per day, or for the full full conference.
Okay. All right.
Yes. So to get to know much more about the conference, please log on to our website, theacademy.co.ug, and you'll be able to get more information and find the contact.
Academy.co.ug.
Yeah.
Okay, all right. So speaking of innovations, what are some of the present-day health innovations that have made a significant impact on Uganda's health system?
I think for me, it's one of the innovations that was very impactful during the COVID-19 epidemic was data visualization. And I think we all consumed that, and it helped us make decisions in our everyday life. Being able to see on a day-to-day in real time what was happening in terms of numbers, in terms of death. You know, we are here viewing a dashboard, but behind that, there were systems that were laid down to ensure that there was data collection, analysis, compilation, and then visualization. But also the use of that data to predict epidemics and say, okay, in December, another bout is coming. In January, another. In June, another. And helping the health sector to prepare for the waves as they came. I think it was something that we all consumed and enjoyed. And but there are others, and I think most of the innovations in recent times have been mostly digital. Remote access to healthcare using remote services is increasing, even here in Uganda. For example, many of us, including myself, have consumed, for example, Rocket Health. And, you know, now people are, you know, consuming health remotely. That's important. Where I come from, the Academy for Health Innovations, we've also been able to do remote follow-up for patients using the interactive voice response. Using a tool called Call for Life. We were actually able to support people who are discharged from COVID treatment units, follow them up for psychosocial issues, and, you know, respond to these again remotely. So a lot of remote care for healthcare has come up, but there also had core innovations that have come up. You know, the incubators that were deployed in Mukono Health Center and Naguru Hospital, and as of this year, it is amazing that the government is still supporting that initiative to, you know, get commercial and continue production. So yes, there are innovations, and if you come to the Health Innovations Conference, you're going to shine a spotlight on some of these innovations, so you will interact a little bit more with what is happening within the health sector.
Okay, yeah, I do agree. COVID-19 helped us to move forward faster than we would have wanted if it was not existent, and the gap of bringing in the health services closer to the people, not the people moving to the health services, that definitely has eased on the detection and then treatment at the earliest time possible. Now, speaking of innovations through the Academy, while you do have all these innovations coming through, you're going to shine a spotlight on them. Let's talk about intellectual property, the protection of these innovations from scammers, from people who are ready to steal at the sight of, you know, presenting millions of money to these innovators.
Yes. So like you've said, Priscilla, when an innovation comes up and it has potential, there will definitely be people who may take advantage. But there are processes that as a country that have been laid down for innovators to ensure that their intellectual property is taken care of. So as a country, and I think I would like to commend Uganda for being part of world intellectual property organizations and regional intellectual property organizations. I think this has allowed us to create a framework in which we operate and protect innovators. And if you're out there and you have your innovation, it can be patented. If it's an idea, it can be, if it's, for example, a production, it can be copyrighted. I'm sure NTV does that a lot and has experience in that. If it's a video or something that you know, have developed and information, it can be copyrighted. If it's, you know, your brand, it can be You can have a trademark for it. And I think that the processes, and I have gone through the process of registering a company, for example. I think that URSB has made things so accessible. I don't want to say simple, because when it comes to patenting, there are processes and things that you must put on the table, and you may need legal entities to support you. But in terms of access, I think it's a click. You can just click and be able to access the platforms where you can register your idea and have it patented. But of course, it's a daunting process. I don't want to say that it's simple. You may have to have legal support to ensure that you have this rightfully done. And again, I would like to encourage innovators to collaborate. Yeah. And when you come to this conference, it's a place where you can network, ask questions, collaborate, understand from other people what have they gone through to register. So don't be there in your corner with your
trophy,
with your trophy, and yet you could get help out there. And this is what we are trying to do.
That's very true, and at the earliest time possible, because the earlier you get to protect what you have innovated, the best it will benefit the rest of society. Now, speaking of healthcare innovations, Ruth, I know that for them to get the fairest and broadest possible benefit to society, it has to come with some efforts that must be made to help them attend to all the stages of the innovation pathway. And how is the Academy doing that?
Yes, when you talk about fairest and broadest, that means you're talking in the spirit of leave no one behind, and that means you don't want to leave behind the vulnerable groups, you don't want to leave behind the minorities, and so as the Academy for Health Innovations, we've taken on a learning role to ensure that we try to develop our innovations in a way that is impactful, but also when you get out there with your innovations, it means that everybody can potentially log on and use it. And so that means you must have an open mindset. You must be able to include everybody. You must go through the pain of, iterating the idea. You go out, develop it with people, go back, make, amendments, go back, ask, is this what, does it seem like what I'm thinking? But also to be able to interact with what is happening globally. I think for us at the Academy, we are lucky that we are situated, within the health sector, and we collaborate a lot with the Ministry of Health. But if you're there and you're an individual innovator, again, the conference gives you an opportunity to interact more with other people. But also it's important for you to be able to interact with real issues, real gaps, real problems. I mean, are you sorting out a real problem that is there in society? Are you able to interact with people who will be utilizing your intervention? Are you able to then fine-tune it to be able to include everybody as a consumer of your innovation? So yes.
The pathway of innovation is long but worth it because it gets to benefit the citizens of Uganda. So Ruth, just to give us a recap of the conference details and how people can get to participate and attend directly.
So yes, thanks Priscilla, and thanks for having us today. Please join us at the conference next week on Monday and Tuesday, the 12th and 13th of December here at Serena Hotel. Between 8 and 5 p.m. Come along and join us. If you have any questions, please, if you see us with our branded shirts, Academy for Health Innovations, the HIC IDI, please come up and ask questions about your innovations and how we can help you. But also remember, you can contact us, reach us on the website, the Academy for Health Innovations.org, and we shall be able to help you. Okay. You can get a lot of information online. We are out there and there for you.
All right, thank you so much, yes. Ruth. And Ruth Obaikol is the Implementation and Scale Lead at the Academy, which sits at the Infectious Diseases Institute right here at Makerere University in Kampala. The conference theme is Building Resilient Healthcare Systems Through Innovation. And innovations have definitely come up, many of them localized at that, which is a move in the right direction to bridge the health gaps that we have presently. And so you can be a part of those. Even you as an an end consumer at one point. You still need to be aware of how these things are created and how exactly they're beneficial. Your voice can actually add to that innovation being better than it had been thought of initially. So that brings us to the end of our Tech Note. Now, in our Kickstarter, we're going to be looking at something that she has hinted on, inclusiveness, something that the government has been patent about. Ministries department risking missing out on budget appropriation because of failing to hand in their framework papers in time. Returning with that, stay with us.